So today we're talking about diabetes in the context of the clinical audit tool, and so I will try my best to give you some thrilling examples on what you can do, what you can pull out, things around patient care, things around Medicare, things around identifying patients that might have diabetes but haven't had a diagnosis recorded, or a coded diagnosis I should say, and a little bit more. So we'll jump straight in. I would assume that most of you, or hopefully all of you, have seen CAT. So this is not really a session for beginners. It's a bit more for people that already know the basics. So I won't really go over all of the basic functionality again. I'm loading my data now. So clicking on the extract, and I'll hide the panel. We don't need that. I've got my demo data loaded, all 8,334 of them. So what we'll do first, I'm trying to structure it a bit around looking at the quality of the data. Do we have a reliable diabetes register in our clinic? Trying to improve on that, and then we're going to look a bit more into patient care, into are people up to date with their checkups, with their pathology and other tests, and then we'll look at Medicare item as well. So have you claimed what you could claim? Are people up to date with their GP management plans and so on? So first thing, what we need to do is make a call on, do you want to look at active patients only with at least 3 visits in 2 years, or do you want to look at all of them? That is really purely your choice, particularly if it is around, if you're in a clinic that has only recently started up, you might not have a lot of patients that had 3 or more visits in the last 2 years. If you know there's a lot of new patients that's come over with a lot of chronic problems, again, the same thing. So really, it is your decision. If you apply this, you will exclude people with less than 3 visits in the 2 years. If you don't touch that filter, the active area here, then you will have everyone. I would say best is probably to check what is the difference, how many of the diabetics are active patients, how many are not. And to start with that, so I apply the diabetes filter and recalculate. So you can see down here, I have 181 patients that have at least 3 visits and also have a diagnosis of diabetes. If I take that out, there's 188. So the difference is only 7 patients in my example, and that might well be very different in your clinics. Have a look and think about if, whatever is appropriate. Normally what we advise, and again, this is really your call, but what we advise is if it is around Medicare, particularly around the GP management plans, you might want to look at active patients primarily, because one of the Medicare rules is that you should be the regular provider, and if the patient has been 3 or more times at your clinic, you're more likely to meet that criteria. But if it's around risk, finding patients at risk, finding patients that haven't had their pathology done and so on, it might be a good idea to think about the not active, meaning less than 3 visits patients as well. I'll leave mine on just because I'm more familiar with the data of those 181, but as I said, it is your call. So that's our population. First question on this would be, how good is your diabetes register? Are you sure that you have 181? Would there be people with a free text diagnosis in there that we can't pick up? Because remember, anything in the conditions filter in CAT needs to be coded. If it's anything free text in your clinical system, it is not counted. The person isn't counted, and the numbers will be off. So what we can do around that is having a look, for example, before we get into the free text issue, you can look at the quality of the ones that are coded. And one thing you can look at here is that we have diabetes type 2, we have diabetes type 1, and we have undefined diabetic here. So there's 6 patients here with a diagnosis that is coded, but it doesn't clearly say, is it a type 2 or type 1? The main reason for that is that when you start typing into the diagnosis field in the clinical system, the first one that pops up when you start typing diabetes is just diabetes without a qualifier. And in the heat of the moment, in a rush, you might just say okay and click, and that's it. And it might have happened years ago when that wasn't as relevant anyway. So, but it means that these 6 people here, we can't tell if they're type 2 or type 1 from their records. So that would be an idea to double click on there and get the list of names up and have a look. Obviously, they all have undefined diabetes in there. Because it is normally not that hard to tell, and the likelihood that have type 2 is much higher, obviously. But it might well be an option to just take that list to your doctors and go over that, and they might be able to tell just by looking at the name, type 2, type 1, type 2, whatever it is, and that can be fixed up in the register. Yeah, so that ideally the goal would be to have 0 with undefined here, have these the type 2 and type 1 only. The other thing that we can do is, rather than using the yes on top, which is an or search, so it is type, when you click the yes on top, it is either type 2 or type 1 or undefined, any of this below. You can do something like this. You can say, how many patients have type 2 and type 1 in their history? And in my case, there are actually 5 patients there. Now, I'm sure you're aware that's not possible. People can't really have both types of diabetes, at least as far as I know. So again, that might be a start for your cleanup to have a look. Which one is correct? Is there an incorrect diagnosis in there? And you might be able to shift some of those numbers. So that's a start, as in trying to get the people with a coded diagnosis, get your register more accurate. It doesn't change the numbers as yet, because we're still looking at people that already have a coded diagnosis, even if it's not necessarily a specific one. The next thing around diabetes register I want to show you is in the cleansing report. So the tab is data cleansing. You could also go to cleansing CAT up top here, or third way from the dashboard, you can go to the cleansing view as well. They all go to the same place, and these are the cleansing reports. And the one that we're interested in here is the indicated diabetes with no diagnosis. And I might have mentioned this in the previous session. Topbar also does exactly the same thing. So we're looking at long-term anti-diabetic medication, an active prescription. We're looking at HbA1c results and fasting blood glucose. If the patient has one or more of these results, and also for the HbA1c, for example, it's a certain cutoff that will trigger the likelihood. So you can see the fasting blood glucose is the highest. So if they're above, I think it's about 7. We've got it. It's in our user guides. It will tell you the actual values. But so the first patient here up top, he's taking anti-diabetic medication. He had an HbA1c of 6.4, a fasting blood of 11. So the likelihood that he actually has diabetes is probably quite high. But again, this is a person without a coded diagnosis for that. And when you look at the numbers here, so we have 125 of our active patients. And remember, we still got that filter, the active filter on, that actually potentially could have diabetes. Now that we don't claim to, this is not a diagnosis. It is purely a very basic algorithm that picks up on these pathology results and the medication. And I better show you, because I just want to show you the numbers, what we actually use in here. And that is under our cleansing. So we with the oh, this looks slightly different from what I thought. Let me just see where the numbers are on the actual pathology we're using under report details. Okay, missing demographics and so on. We know about that one, kidney disease, but this is the diabetes. So these are the results that we're using. And the color, so the red, orange, or yellow, indicates the likelihood from likely over possible to a review, have a look, but we don't think it's very highly. So if someone is taking metformin, but no other of this, of the HbA1c or the fasting blood glucose is in place, then they will get a yellow color. If the HbA1c is between 6 and less than 6.5, or they're taking metformin, then we get an orange there and the red as well. So that's basically what's underlying the coloring in here. So I really can't tell you what the actual numbers would be out of those 125, how many will end up with a diagnosis and that have a free text diagnosis in the record now. Again, have a look at your data and go through. You can see in this report, it will also list the assigned provider, so you can sort by that as well. So you could allocate lists, but ultimately this really needs someone to look at their record and to see what the story is. Is there an old free text diagnosis in there, or has it just never been put in? The other option in here is that we can exclude these patients from future being flagged for diabetes. If you find that, yes, they are taking metformin, but there's another reason for that, then you could just click on here and say we want to exclude that flag in the future, save and remove. That will take that patient out. Under the Review tab, you can see there are 2 people now. Oh, is that the same one? It must be just come up twice. So sorry, I think it's just an error in display. I don't know why it's there twice. But it will tell you when it was reviewed, if it was reviewed using CAT or Topbar, and who was the person logged on to CAT who did the review. So the same thing you can do in Topbar. If that flag comes up in the cleansing app and says indicated diabetes but nothing recorded, you have the option to also get rid of that prompt, and that will be reflected in CAT. So the two are talking to each other. Now that we remove this patient from CAT from this particular report, they won't be flagged in the Topbar for the same thing because it's a one-off decision. So that's something that I know will take a while to go through these patients. But when you look at the numbers, yeah, so there's 124 potential patients with diabetes. If we go back into our filtering for diabetes again, and we know from before, we have 181. So potentially there's actually more than 300 patients at this practice with diabetes, not just 181. All of the following things I will show you rely on your patients having a coded diagnosis of diabetes. So if that's not the case, we just can't find them. So if we're searching for are they up to date with their HbA1c or other pathology and using this filter here for diabetes, then if they haven't been diagnosed, they will not be in the report. That's why I thought we'll just go over the actual diabetes register first to have a look at that in terms of quality. So now we're filtering again for active patients with diabetes and having a look at pathology. There's other things as well, of course, but I'll start with the HbA1c. So we have 181 patients there. Out of those, 9 never had an HbA1c recorded. Yeah, so these are, despite we know they had 3 visits in the last 2 years and they have a proper coded diagnosis for diabetes, at this particular practice, they had never an HbA1c result recorded or in their record. There could be reasons for that, whatever it is, but that's what we can see from the system. One thing that I might have mentioned in the previous session, but I'll just show you again quickly. If we wanted to get the names of people with a high or elevated HbA1c, highlighting that part of the graph, clicking on export, will give you their details. So you can see in here the actual result for the HbA1c and also the date when it was done. And that's what I wanted to just emphasize again. The oldest date of what we have in here is more than 5 years old and is pretty useless really. The reason for that is that when we extract data out of the clinical system, we pull out the last available result only. So each CAT extract has only one result for pathology, for the measures, for MBS items as well, and a couple of other things. So in other words, if you leave it as is and you look at this result, this graph at face value, it actually could be quite misleading, because if you wanted to know who never had an HbA1c recorded, the answer is 9. That's great. But if your question is who didn't have that particular test done in the last 6 months or 12 months, then you need to work with another filter, and I'll show you that. This is the date range result filter. And let's say we're strict and we say every 6 months. That's what we need, what we want for our patients with diabetes, and recalculate. And you can see that made a huge change to the report. So we're looking at the last 6 months now from the day of the collect. My data was collected back in June. In a life scenario, you wouldn't want to work with data that's 2 months old or more, but just pretend it's today's data. So the 6 months back will be always from the day of the collect. And that shows me there's 77 people that actually didn't have that particular test done in the last 6 months. It also means that the values that we can see for those with a result, so we have 65 people that are at 7 or less, and the others in here, that's actually a bit more informative, because now we're only looking at up-to-date results. That actually allows us to see how are these 77 minus 181, now that's 104 people with a result in the last 6 months. how are they managing their blood sugars, or how have they managed over the last 6 months. And the same, what we've just done for HbA1c applies for all of the other pathology results. So if you're interested in lipids and 6 months is the right frequency, you could look at that. If you're interested in blood pressures, going to the blood pressure report, we're still looking at the same people and results in the last 6 months only. So you can see that 61 of them did not have, which is nearly 34%, did not have a blood pressure record in the last 6 months either. And that's really one of the key things how you can use CAT for looking at, for one, at the actual results and how they spread over the patients that did have the particular test done. But of course you can also find the ones that are overdue for their HbA1c in this case, or their blood pressures or anything else. Now if we go back and I just put it onto 12 months, and you can see again that made a difference. So we have only 32. So again, that is something up to you if you want to look at be very strict with the frequency of the testing, or if you say, oh well, once every 12 months is fine, and that of course will reduce the numbers and might make it focus it. So these 32 people are probably more urgently to be seen. I mean, we know they have been in, they have visited the clinic, but they haven't had the pathology done. So that's testing as in measures, blood pressures and so on, weights and heights and pathology. The same filter, the same date range result filter it's called, applies to Medicare items as well. So if we go to the MBS items here, now you can see my 181 patients. You can see what they had recorded in the 12 months previous to the data collection. And you can see 62 of them did have a GP management plan built, paid for, I should say. So when we look at Medicare items, we look at your billing system and we pull out a payment receipt. It is not that you send a claim in, because if the claim is rejected, then that item wasn't claimed. So we only count an item as actually claimed when Medicare has billed for it. Paid for it. You've billed, they paid. And you can see also the reviews and so on. So that will tell you who did have that particular item claimed. The second tab, the not recorded, will show you who didn't. And that's of course 119, 62 plus 119, that's 181. Double click on there, will show you their details as with the other reports. And the last column will show you if, like the first person here never had that item claimed, and the next one did have the last one done in 2013. You can sort here, and you can sort by date. So the first person coming up here did have their last GP management plan done on the 4th of June 2016. Remember, we're looking at data from the 6th of June this year. So this person is really just 2 days out of our 12 months. So that might be too soon, which of course means you can change your date range. You can put in 18 months if you want to be more on the generous side, or even 2 years. But ultimately, it will tell you in this report anyway when the last claim happened. When you look at the 119 with the claims, if we go to the second page, you can see these are all from 2014, then we go to 2013. But the last, so the oldest is from 2006. But then there's actually quite a few patients that never had the GP management plan claimed. When you think about this from an efficiency point of view, if you're starting to recall patients, the ones that are, we know they are visiting your practice, but this last list here, the ones we're looking at now, they never had that particular item claimed. The reason might well be that they're going somewhere else for their diabetes care or for their GP management plans for other chronic problems as well. So in terms of looking at who to recall for this particular Medicare item, you'd start with the ones that are most recent. We know they all have diabetes, we know they all have visited at least 3 times, but based on what we see from their history in claiming, they're probably not all being looked after for their diabetes care at your clinic. And that's just another way to reduce the numbers, to bring in people first, in this case, that are possibly more responsive or actually eligible for the item to be claimed. But the same thing applies if you look at back to our pathology report, where we can look at not only who never had it claimed or not claimed in a certain date range, but also who had high results, for example. So if you wanted to say, well, we would really like to see the patients first that did have very high or high HbA1cs in this case, or high blood pressures, whatever it is, then we should bring them in now. So I'm just going to stop it here because I want to show you something else. I'll unmute you, and you're all back online. Any questions to what we've looked at so far? Anyone still there? Okay. No questions? Fantastic. All right. Well, you're back on mute, and I'll keep going. Like I said, please speak up if you have a question. Just happy to interrupt me anytime. *7 will get you online. So this is around pathology and the MBS items that we looked at in here. There is, of course, another MBS item that's important for diabetics, and that would be the diabetes SIP item. So if we look at my practice here, we're looking at 12 months. 155 out of my 181 did not have that item claimed. On the face of it, you'd say this is a loss of income. The practice could have claimed quite a bit of money there. I don't know why they haven't done it. This is real data, it's just been de-identified, but it looks like they're missing out on a fair bit of Medicare funding there. Like I said, there might be a reason, but purely from the numbers, that's all I can tell in here. And same thing applies. A double click on there will show you never recorded, but this one was in 2014. So the same principle applies there. So that's a way just looking purely at the actual item, but we can also, with the diabetes SIP item, we have a specific report that applies or shows you all the items in there. And you can see this. And I would say that probably for most practices where I've seen this report, it looks the same way. The very low number of results here for the foot exam and also the eye exam. With medical directors, so this is a medical director database, even though it says up top here best practice, but it is MD. The way to enter the foot exam is very specific. It's buried a long way in the clinical system, and even if this practice has done a lot more foot exams or recorded that they were done, they most likely have recorded them somewhere else. The worst spot is, as always, in the progress notes in free text. But there's another couple of boxes that people tick because they think that will do the trick, but that doesn't, unfortunately. And so basically, they're quite, for medical director, it is in the diabetes assessment, and then you click through a couple of screens, and then there's one tick box that says head foot examination. And if that's not clicked, it's not counted in here. The eye exam is on the same diabetes assessment, it needs to be clicked in there as well. And unfortunately, that can't be added in MD by using the add values because it's not on that screen. I think best practice has added the foot exam on that first screen, but it is still similar that there's quite a few screens to go through to get to the right spot to be able to record this. So we're aware of that, but unfortunately we can't really do much about it because that's the dedicated fields for it. I've actually logged one improvement there for to pick up on a podiatry visit. So if the clinic records that the patient has seen a podiatrist, that I think it's fairly safe to assume that the foot exam was done. Yeah, this foot exam in here doesn't have to be done by a podiatrist. It can be done at the clinic as well. But like I said, if they actually go and see a podiatrist, it's fairly sure that they would get someone to look at their feet, which would meet that criteria. But that's something that we might add in the future, that if that podiatry box is ticked, that it will count it as a foot exam as well. Currently it does not. The second tab in here is just the opposite. So the items remaining, you can see only 2 people had a foot exam done in the last 12 months. And the last screen in here looks at the same information, but it's kind of pivoted around. So what we're showing is 0 people have all 14 items done, 2 people had 13, 6 have 12, 19 have 11, and so on. Or on the other side, 3 of my 181 active patients with diabetes had not a single item of the 14 items of the cycle of care actually recorded in the patient record. Starting from the right is the easier way, and I guess that comes back to what I said before when you sort by date and so on. So these people that I've highlighted now, the columns here, they are the ones where you only have to add 4, 3, 2, 1 items to complete the cycle of care. And clicking on the worksheet will actually bring up all of the details in a worksheet, as the name indicates, patient details, and then the HbA1c result, the I result, and so on. Now these are, even though I actually have a filter applied here for the 12 months, this has its own built-in filter. The active patients and the diabetes condition works, but the last results is irrelevant for this, because as you can see, for example, we have blood pressure 6 monthly and 12 monthly, so every 6 monthly I should say, same with the BMI and so on. So this report has a pre-filter built in that ignores our date range filter anyway. But you can tell, of course, what we know, that there's very few people with a foot exam there. One thing, if you're not sure, you can sort by here, and you can see these 4 people did have a foot exam recorded. You can compare their record to another one, and you can see, maybe they have it in the progress notes or somewhere else, but only these 4 have it recorded in the right spot. And that's one way to look at these patients here. There's a little trap in there, because if you think about it that way, we're looking purely at are all the items entered, and it tells us 0. So no patients did have all items in there that are needed to actually claim that item. But if you go to the MBS item report and to the count, you can see actually that 26 patients did have the diabetes SIP item claimed in the last 12 months. Even though CAT tells us in here that 0 had all items done. And that goes back to the practice staff knowing, and again it's particularly around the foot exam and the eye exam, they know that it was done, they know where they recorded, and so they can claim, and I'm totally being pure at heart here, saying they wouldn't claim if they haven't finished all the items that are needed to finish the cycle of care. So that means they've looked at the patient's chart and they learn from there, yep, all items are completed, so we can claim. Whereas CAT is limited in looking at this dedicated fields for these items, and we think, or this report leads you to think, none of the patient actually is completed. So what we can do to, let's say we're going to work only with those patients here that I've highlighted, so 4, 3, 2, 1 of the items missing, we're ignoring the ones with more, and if you bring them up as a worksheet, as I did before, you can see there's 57 patients that have at least 4 items missing, or at most 4 items missing, and we can combine that with the Medicare item. So this is called a cross-tabulation, and what I'll do is I'll highlight the diabetes SIP item not recorded, and we still have these 4 bars selected. You can see there's a little dot next to each of these. And what the cross-tabulation does, by clicking on the report icon up on the top here, it will combine the 2 reports, and it will combine them into an AND search. In other words, it will only be people that meet the criteria selected in all of these reports. So only 4 or less items missing, combined with no diabetes SIP item claimed. So if we do that now, you can see there's only 36 patients. Remember, it was 57 before. So these 36 are missing at maximum 4 items and had no diabetes SIP item claimed in the last 12 months. And they might be the ones you want to target first, because for one, we know they're easy to complete, they don't have much missing, and they might well be already completed, but the information has been recorded in a different spot. And of course, they are the ones that are easy to complete because they don't have a lot missing. There's only up to 4 items missing. So I know this is probably new to even more experienced CAT users. Not many people use the cross-tabulation, but it is really, it makes the whole, it gives you a lot more options really across all of these reports. This was an example for a selective cross-tabulation where I've only selected 1 item in there. But I'll just show you an example for something else. So if we go in and you're looking at our pathology again, and let's be strict once more with the 6 month. and we're back to our 77 people with no HbA1c recorded. If you want to know, who are the patients, you just double click as I did before, so you get the details there. What we don't show in here is who is their provider. So the cross tabulation also allows you to just add information to an existing report, and that could be the HbA1c alone, or you could add lipids as well. But what I want to show you is just for one. So I'm going to the visits tab, and if you haven't looked at that, there's actually quite a bit of nice information in there. Some are purely around statistics, who visited, how many times, and so on. Have they visited in the last 6 months? So you can see out of the 181, 160 have actually come in the last 6 months. 18 have been in there in the last 6 to 12 months, and then you have like later. Because we're filtering for active patients only, we're only looking at the last 2 years. But the one I wanted to show you is the assigned provider. I don't know if I mentioned that in a previous session, but providers are assigned for medical director users purely based on which provider has seen the patient most over the last 18 months. In best practice, it is based on primarily in the patient record, if there is a GP put in as the normal doctor or this patient's doctor, then we use that. If the field is empty, we use the same formula, the 18-month. And for the other systems, ZMed also has a dedicated provider and so on. It is different for each of the clinical systems, but basically if there's a field, we prefer that. If there's nothing, then we use the 18-month and the most contacts. So to combine our HbA1c report or any others, if you're interested in, with the providers, what I want to show you is, so I've done the select all on here. We've got all providers included now, and we also got our no HbA1c recorded. So if I do a cross tab of this now, this is still our 77 patients, and all we know is that they had no HbA1c done in the last 6 months. But because we've added the provider report, what we get now is the assigned provider. So for a practice manager, for example, what you could do is then use this report to break it down into the different doctors and have a look what's happening there. Or if the doctors are interested to know, if someone says, I want to see out of my patients how many did not have this particular pathology result entered, that will give you the information in one report. But of course, you can also use the provider filter for that. That will do the same thing, but I just thought I'll show you a combination there with the visits report, just to give you an idea what else you can do with the cross tab. I'll get out of that now. And while we're here, I think I'll just want to show you one more thing. Let me clear my filters. What we've done so far in CAT was really all based on the user coming up with a question. Who do we want to look at? Patients with diabetes. We want to look at results in the last 6 months. We want to look at their HbA1c. So that requires you to apply the filters and then look at the report. One of the more recently added reports is this one here, the MBS eligibility, and that one doesn't need you to do anything with the filters. So it's a pre-filtered report. It might not be 100% of what you're after, but it doesn't need you either to think about the question and to get the filters right and all of that. So there's 3 tabs here. One's around health assessments, and you can see 75 plus. So we just go purely by age and what has been claimed. 45 to 49 never claimed, and the indigenous health checks. And this is the one I wanted to show you here. Now, of course, it's the same number as what we can see from our other report, from our Medicare item report. But here you don't have to filter for condition. You don't have to filter for the results in the last 12 months. It will just come up straight with the numbers. 188 patients, because remember, we haven't filtered for active now. I've taken all filters out. And out of those, 162 did not have the ZIP item claimed in the last 12 months. And the last one here, it's not just about diabetes, but what we're looking at is diabetes, cardiovascular, and chronic kidney disease. If they have at least one of those out of these groups of chronic problems, if they have at least one diagnosis in their record, they will be included. You can see there's 499. If I decide that I only want active patients, I can add that. And you can see we've lost 34 of them. Still, the majority is still there, 465. And you can see 192 never had a GP management plan or team care arrangement claimed. You can see people that did have one claimed in the last 18 months or longer, but no review. And here the ones review that's more than 6 months ago, and so on. I'm sure you get the picture there. So again, what we're trying to do is make it easier there. You do not have to filter for the conditions. You do not have to filter for the date ranges. It's all built in. There's always people that prefer to create their own queries and their own filters, but there's also a lot of people that like to have it presented to them, the information with a one click, and that's what we're doing in here. I'm just trying to think if there's anything else directly. Well, you might want to look at this one here. The comorbidities could be of interest. So what we can do there, because we're looking at diabetes in particular, if I add diabetics only, so we have still our 181. So what this report will show you is, obviously, all have at least one chronic problem. So there's the 30 that have only diabetes, but then we have 66 with at least one other. We have 51 with 3, and so on. So we could just highlight all, and then click on this worksheet here, and that will show you, no surprises here, they all have a yes in that column, but it will show you who has also respiratory conditions, also cardiovascular, and so on. So that might just help you again to narrow it down, so you can sort, as with all of these, narrow it down to the people that are, very sick. Obviously, we have people here that have, how many are there? 1, 2, 3, 4 that have everything basically that we look at, and then of course the numbers go down. But there's still quite a few of the patients that have multiple chronic problems, and that might help you again to target who you want to recall, who you think should be seen first, and so on. On our help website, if you go to CAT, and you can get there from CAT as well. There's a number of ways you can go from help to CAT user guides, or from the dashboard. There's our recipes and user documentation. I'm actually going to the recipes from here, because there are quite a few things in there where you can have a look at recipes, step-by-step guides that will talk you through. Now, there's around asthma, cycle of care, there's health assessments, mental health treatment plans, and so on. There should be also something about diabetes. I was pretty sure there is. I might have to add something in there. Well, there's one here. Identify patients with diabetes without HbA1c results recorded in the last 12 months. So that will basically walk you through what I've just talked about. All of these recipes have the same design. They have a name, a rationale, why do we do it, what's the target, and then starting point in CAT. This is where you start. You go to the conditions filter, you tick the diabetes, yes. You tick the 12-month date range box, and you go to the pathology HbA1c report. Exactly what we've just done. So you don't really need to know all these things top of your head. Looking at the recipes should get you quite a good idea about things, but also just exploring a bit, because the mechanism that we looked at is really the same. Be it an HbA1c or lipids or blood pressure result, it's just up to you to check for the relevant or the pathology test of interest in that case. All right, well, thanks everyone for your time then, and have a good afternoon.